All right. Hey everyone, in this video, we'll cover 7 tips to help you succeed on your pediatrics rotation. So we'll go ahead and get right into it with the first tip. So the first thing, the most important thing I would say on pediatrics is emotional intelligence. And this may seem super obvious, but it's especially important for pediatrics because it's kids, parents, and people who really like spending time with kids. So the first thing I'd say is make sure you connect with your patients and as well as your residents and attendings via communication skills. That's going to be really important in how people assess you and how you're sort of graded in your rotation. So that leads into the second thing, which is read the room. So reading the room also sounds intuitive, but just to give you some examples, so if you're in a patient's room delivering or being a part of a serious news discussion, you don't want to use that as your opportunity to say a joke, which may sound super obvious, but there's more subtle examples. Like, for example, like if there's good news, that would be the appropriate time to maybe throw in a joke or add a funny comment. So you have to sort of read the room in these things. And if you do this right, it can sort of pay dividends in how your patients and how your faculty and attendings and residents feel about you. And as well as the last thing here is always show enthusiasm, even if you don't think you'll do pediatrics in the long run. Patients and residents and faculty alike can greatly appreciate people who they know you have an interest and you still show enthusiasm every day you show up. So this all fits in the bucket of emotional intelligence. So the second thing that is underrated, and I don't hear a lot of people talking about, is basic science knowledge. So the shelf exam draws a ton on the basic sciences. We'll talk more about it later, but just to keep this on your radar. So if you see information in your textbooks or in your question banks that's basic science heavy, don't discard that thinking that it's clinical rotations and that it won't be important. It can come back to be really helpful. So it's also a great way to stand out as a student. Like, for example, on rounds, basic science information, for example, is a great way if someone asks you a question on how do you approach an antibiotic treatment, you can use basic sciences in terms of mechanism of action and knowing what pathogen you're trying to treat. And you would need to have basic science knowledge to know that, rather than if you try and memorize every scenario, that'll come throughout third year and fourth year. But if you have basic science knowledge, you'll be able to apply that and you can sort of show them your thought process as you think, and that'll help you stand out quite a bit. That again sort of leads into the last thing. The fundamentals of basic sciences can help even with guessing. So there's plenty of times where attendings or residents will ask you questions. They don't necessarily think that you'll know the answer off the top of your head. But at the same time, if you have sort of a great foundation in your basic sciences, you can throw out a guess and explain what you're thinking, and you'll get just as many brownie points than if you got the question itself right. Because the point sometimes isn't to get the question right, it's to show them how you're thinking. So that's the second one. The third tip I would highly recommend is mixing 2 question banks. And I know the first thing people think that this sounds intimidating because it's hard enough to do 1 question bank on a rotation. And when I say mix 2 question banks, I don't mean do double the questions. I just mean alternate each question bank. So the 2 that I typically recommend, because I find them to be the most helpful and most relevant, are UWorld and AMBOSS. Both have different strengths in different areas. I think if you did either individually, they both cover the high yield information very effectively. So I don't think you can go wrong choosing either. I know some people worry, well, should I do this one or should I do that one? Which one's going to be the most helpful? I think either or would be fine. So the last 2 points here, doing both helps review specific concepts 2 times. So it's basically like extra space repetition. If you think about like clinical decision making and the questions you're being tested on your shelf exams, a lot of it comes with practice. And if you can see a question, even if it's slightly different, but a similar thought process 2 times, your brain will be that much more comfortable with the third time you see it, or if you see it in an exam room or on a shelf exam. Then the last thing I think is the best benefit of using 2 question banks. Content that is unique to each Q bank will be bonus prep for lower yield things that not everybody else knows, or for really challenging topics. So I know there were always the topics that confused me, and doing it again with seeing it slightly different ways helped me sort of master that concept. And I think that both UWorld and AMBOSS, again, cover the high yield information very effectively, but there's differences in their questions, and it will make you much more comfortable with dealing with a wider array of questions, which on exam day will help quite a bit. So I would not focus on counting the number of questions you're doing and focusing on, I need to hit this number by the end of your rotation, because that all varies depending on your schedule, how busy you are, how early you have to get up. I think what I tried to sort of structure my schedule was, if I did UWorld one day, I would try and do AMBOSS the next day, and so on and so forth. Obviously, this is budget limiting. If you're able, sometimes schools will have a way to get a class discount that you can get for larger groups that might help make it more affordable as well. Not a must do, but it can be helpful, and I don't hear a lot of people talking about it. The fourth thing is milestones and dates, and this is obviously very pediatric specific. A lot of people are very intimidated by milestones and dates because it's just remembering hardcore numbers and cutoffs. So the first point I'll say is, do not overstress if you have difficulty keeping each milestone and normal date in your head. That is a normal thing. I think most people struggle with these because they're so arbitrary. It's just kind of a you know it or you don't. There's not a lot of framework of thinking that you can kind of reason through. It's mostly just knowing it. But that leads into the second point. So there are some milestones that organize well. Those are the easiest to remember. And if you focus on those, you'll have the maybe 60 to 70% of the milestones in your head. And then you can kind of just cross off the other few without having them memorized. And so the last thing here is practice these early and often. The earlier you do this on a rotation, by week 3, week 4, towards the end of your rotation, you'll realize, hey, practicing these early paid off. If you master these in week 2, then by week 6, week 8, if you have a rotation that long, you'll have had 4 to 6 weeks to benefit from it, where your patients know that you know these things, your attendings know, and people will notice those things. So I really recommend practicing them early, but don't be intimidated if you find them really hard. I think that's a pretty common thing. So next here we have shelf exam advice. So the first point, know your congenital syndromes. That point alone on this slide would make this tip an extremely helpful tip. Know your congenital syndromes by heart, even the ones that seem rare. It's worth knowing. If it takes a couple minutes to learn it, then just learn it. It'll really pay off. The pediatric forms from the NBME can also be very helpful. They can test some of the weird syndromes, which can help sort of refresh it in your brain and see how it can be asked in a question format. I also highly recommend filter decks, Anki decks, before taking your exam. So as close to the exam as possible. So this is in addition to, if you're doing Anki, doing it in the traditional sense where you do a handful of cards every day to cover your topics. Then a couple days before your exam, you pull a handful of the cards from the pediatrics deck into a separate filter deck. You do those, and so you can basically rapid review through all the stuff that you already know. It'll make everything come to the forefront of your brain right before you take a test, which is a great feeling. Rather than knowing something's on the tip of your tongue, but you can't think of it, it really helps cover that whole problem. So it can be a little intimidating, so I would space it out over 3 or 4 days, but doing a filter deck can really pay off, especially for forgetting things off the top of your head. And then the last thing I'd say is watch a full-length review video on day 1 and then the final day before you take your exam. I think this is a commonly recommended thing. The idea is that on day 1, you can see this stuff. And so then you start on day 2 of your rotation and you notice, oh, hey, I saw that in the video yesterday. And you sort of play this familiarity game, catching up and learning concepts. Then on the final day of the rotation, you watch it again and you realize all the stuff you've learned and you can rapid review everything. So the filter decks and the review video are kind of the same thing, but the filter decks are more of an active learning where you test yourself. So obviously we've covered a full-length pediatrics review video. So if you want, I'll link that video above. And if you find that helpful, it can be good to do on day 1 and then just before you take your test. So everything is really fresh in your mind. The last thing here, or second to last thing, is going the extra mile. So just like this says, this is going the extra mile. These things aren't required. There's not any sort of written down rule that you have to do these things. These are just things that I personally found helpful and found that people noticed or talked to me about and brought this up. So the first thing I would say is ask attendings for tips. And then once they give you tips, so say, hey, I'm curious what I can do to improve, or I notice I'm struggling with this, then and ask for their advice and then demonstrate your improvement. So if you ask for tips and advice, that's great. I think anybody would respect that and they would appreciate that you're forward thinking enough to ask for advice. But then if you work with an attending for a handful of weeks, and by the end of the 2 weeks, you demonstrate, you focus, or you tell them, hey, I've been working on this, and you talk about like asking if they think that you've improved or whatever the case may be, that will really be going the extra mile. And I knew that a couple people mentioned that to me specifically. Another thing that can be the extra icing on top is some people talk about adding research to presentations. So this is nothing extensive. It's hard to keep up with your insane, like especially ward schedules, and be adding research to presentations. But especially if you have a really interesting presentation or an interesting patient that a lot of people were confused on, maybe hadn't heard of the disease or wanted to know more, you can just say, hey, at the end of your presentation, I also found this article because I wanted to learn a little bit more about this condition and talk about some of the helpful, like high yield tips that would be useful in a clinical scenario. I wouldn't bore people for minutes and minutes with extraneous details about everything you've researched. It's not about bragging rights. It's more so everybody can learn from your patient. And then the contrast to this is giving a single informational talk. So you can ask your attending, hey, when I'm on rounds, I noticed I've been seeing this patient for a few days, and I know that this is a really interesting case presentation. Would you mind if I did like a brief, like 2-minute presentation and brought like a sheet of paper so everybody can see what I'm like, slides on a PowerPoint, and you can say, hey, I'd like to give just a brief presentation. I think most people would appreciate that, because again, it's another opportunity for everybody to learn, especially if you do it coming from a perspective of, I also want to learn. Definitely don't do it in a bragging sort of way, because this is just something you looked up the night before. And the last thing, another example, is helping with small tasks. I think this is especially helpful in pediatrics because kids in the hospital, kids in the nursery, and kids in clinic oftentimes require extra assistance, especially if the attending is performing the exam or talking to the family members. You can often help with small tasks. So an example I wrote down here is, I would wipe down the rolling computers before rounds. And especially with the pandemic, this is something that already got done. So somebody did it. And if you do it, it helps save everybody time. So basically, if the person leading rounds or the chief or the attending is trying to get rounds started, but then we have to wait a couple minutes somebody to go find cleaning wipes and then wipe down the computers, it would delay the whole process and it would start to become inconvenient. But if you just sort of take the initiative and realize, well, this needs to be done anyways, and I'm here already, it can be a great way to help and show that you want to participate. And obviously there's limits to this. There's going the extra mile and there's doing too much. So do things, read the room again, and do things that are helpful, but not doing too much at the same time. And so the final point here is optimization and tips. So I highly recommend using hospital downtime for questions and flashcards. So if you work a 6 to 6 schedule, you might be wondering, how am I supposed to get questions done? How do I do Anki and question banks? A lot of times in the hospital, especially, there's downtime. So you might have a long lunch break. You might have an extended afternoon when there's no admits. If you know you can at least have like maybe 20, 30 minutes, you can knock out like a handful of questions. If you maybe have only 5-10 minutes, you could knock out some Anki cards. And then if they say, hey, we'll give you a couple hours, we won't take any admits for the time being, but we need you to be on standby, you have a couple hours, find a quiet area. That might be the best chance you have to knock out a significant number of questions. So I really do think that that's helpful for any rotation, but especially some that are hospital-based like pediatrics. So going back to milestones, practicing them when you visit with patients is a great way to actively learn the material. So before you go into a patient's room in clinic, you say, well, okay, so I know this is going to be a 12-month-old patient. So you think about what milestones you need to cover and looking and comparing the patient so you can sort of have a visual picture, which can often help your memory. You have a visual picture of what the patient is doing, and you also have the mental image of what milestone they should be meeting. So it's a great way to sort of go through them systematically. And then you can also impress whenever you bring them up and say, hey, I think this milestone was ahead, this one was behind, so on and so forth. But the most important thing for this is practicing them when you visit with patients will help you remember them more than just reading them, because reading them can often just slip your mind. And then the last sort of tip is prioritizing the comfortable parts of the physical exam. And so the example I would list here is the ear exam. For young kids, they almost always need an ear exam, even if their ears aren't irritated. But if you do them, you have to pull on the earlobe, and most kids that young are not having it. So if you did that at the very beginning of your physical exam, they would be angry, they would be crying, and they wouldn't want to spend the rest of the physical exam with you because you're already being invasive as it is. So I'd prioritize the most comfortable or the least invasive parts of the physical exam first, and you can sort of play a game, like make it more interesting for them. And then later in the physical exam, when you know you're wrapping up, you can do the things that are the least comfortable, such as the ear exam. That was a sort of a minor tip, but I know that some people can be really uncomfortable with the physical exam, and this can help make it more comfortable for you and more comfortable for the patient. So that's all I have for you today. So keep in mind the review video we have on pediatrics and use that if you want day one and then before you take your exam. And good luck.